My name is Crystal Fix. I am a senior athletic trainer specialist and supervisor for Banner Sports Medicine in Phoenix, Arizona. I currently work in the clinic as an athletic trainer, and I oversee the clinical athletic trainers and orthotechs for our 4 locations. As an athletic trainer, I am trained in the prevention of injury and athletic-related illnesses. This includes everything from identifying what's wrong with the patient when they first get injured, potentially calling 911 and getting any emergency care that they need. We do all kinds of rehabilitation, manual therapy, brace and splinting, casting fabrication for them, as well as multiple administrative duties and working with all the different entities that are involved in an athlete's time when they get injured. I initially got into athletic training because I was an athlete, I had multiple injuries, and I didn't actually have an athletic trainer that was able to help me kind of navigate that process. And once I learned about what an athletic trainer can offer, that really drove my kind of love for the profession. The thing I love most about being an athletic trainer is the relationships that I create along my journey and being able to help the athlete from start to finish when they are faced with injury. When an athlete gets injured, I'm there from the moment that the injury happens. It's often the worst day of their athletic career, and then I get to be with them alongside this journey the rest of the way. I help them with their daily treatments. I help them navigate which doctors they need to see, which physical therapists, other medical providers along the way, and then I really get to see their development as they grow, and I get to be that mentor and that support person to them as they regain their strength, they regain their range of motion, and get back on the field. The strongest skills that you need for an athletic trainer are communication and trust building. As an athletic trainer, you must be able to communicate with coaches and parents and athletic directors and physicians. You need to be able to explain to an athlete what's wrong with their injury and the next steps that they need in order to get healthy. Another skill that I use is trust. As an athletic trainer, you must regain an athlete's trust, parents' trust, so that they understand what's going to be happening with them and how to get back. When you're applying a cast, they need to trust that you're confident in your skill set and know that they're going to be safe when they're in this device for a longer period of time. They need to be able to trust that you understand what rehab exercises are appropriate. They need to trust that you're going to an appropriate provider and that you always have the best interest in mind in helping them return to play. One of the top subjects athletic trainers use is science. Athletic training is a science-based profession, with our foundation being in anatomy and physiology. Without an in-depth understanding of anatomy and physiology, you wouldn't be able to do the job. To become an athletic trainer, you must first graduate from high school. Then you have to attend a 4-year university for a bachelor's degree. But in order to have a stronger foundation going into your athletic training schooling, it's recommended to do a science-based or kinesiology-based program. Then you must go to a master's program that is accredited by the Commission on Accreditation for Athletic Training Education. During those 2 years of a master's program, you will take in-classroom type courses as well as doing clinical rotations where you're out in the field actually practicing the hands-on skills to learn how to be an athletic trainer.